Auspicious greetings, brothers and sisters. I'm Choymi. Welcome to the program, which today we are going to talk about one of the most important organs in our body. Before we begin, I would like to acknowledge that this program is brought to you by Fo Guang San SS3, Petaling Jaya. We are honored to have Dr. John Chan Kok Ming with us today, consultant cardiothoracic surgery from Cardiac Vascular Central Kuala Lumpur Hospital, and he will share with us what is the best treatment for heart disease. Dr. Chan, you may begin.
Thank you very much for inviting me today to speak on what is the best treatment for heart disease. So I've got a model of the heart here. I hope you can see it. And the heart is basically a pump. So it pumps blood around the body. So for the heart to work, it's got its own blood supply. You can see some blood vessels on the surface of the heart. And these blood vessels can get diseased. So most of it is caused by cholesterol, for example, lifestyle factors like cholesterol or smoking or lack of exercise and what we eat. So it's important that we take care and maintain a healthy lifestyle, take exercise regularly to prevent these arteries which supply the heart from getting disease. If the arteries do get disease, then what happens is that the heart does not get the blood and the oxygen it needs. So very often patients with what we call coronary artery disease or narrowings in the blood vessels of the heart will feel some discomfort around the chest. Sometimes the discomfort can go down the arm or go up to the neck. And then sometimes they can feel sweaty or short of breath. So these are all symptoms of heart disease, coronary heart disease. If it happens very suddenly, then the patient can feel very, very uncomfortable with very severe pain. That is when they have a heart attack. Most of the time, the patients will get these symptoms when they exert themselves, so when they walk or when they do some exercise. So it comes on exertion, because on exertion, the heart needs more oxygen and nutrition. And if there are narrowings on the blood vessels supplying the heart, then the heart is telling you it needs more blood, more oxygen, and that's when the patient gets the symptoms. So there are a few ways we can find out if the patient has got coronary disease. One of these is just doing an ECG. ECG is a heart tracing. We put some electrodes on the heart, and that will tell us how healthy the heart is. We can also do an echo scan. An echo scan is like an ultrasound scan of the heart, which will tell us about the heart function. And then we can get the patient to do some walking or exercise on a treadmill, what we call a stress test, while recording the ECG and echo. And that will also give us an idea of whether there's any problem with the blood supply to the heart. And we can also do a CT scan. A CT scan, at the same time, we inject some medicine into the artery in the hand, for example, and that will show up the arteries in the heart. And so we can tell whether there's any blockages in the blood vessels of the heart from what we call a CT coronary angiogram. And another way to find out is a more invasive coronary angiogram, where we have to put a wire up through the artery in the arm or in the leg, right to the heart, and then inject some medicine to light up the arteries of the heart. So we can tell exactly how bad the disease in the heart coronary vessels are and how many arteries are diseased. So most of the time, the coronary disease is not too bad. So there may only be one or two narrowings in one or two blood vessels of the heart, and the narrowing may not be too bad. So if that's the case, then usually if you take medications for the heart, and there are quite a few different types of medication you can take, this will be sufficient. So medications like a blood thinner to thin the blood, some aspirin or Plavix, and then some medication to relax the arteries of the heart, and then there are other medications which can slow the heartbeat down a bit, medications to control the cholesterol, for example. So most of the time, coronary disease can be controlled very successfully with medications. And of course, with changes in your lifestyle, taking a healthy diet, and then if you're smoking, to stop smoking, and then to start taking some regular exercise. If you have got high blood sugar, diabetes, then to control the blood sugar. So all of these factors can very often control coronary disease in the early stages. If with taking medications, you still get symptoms, still have discomfort in the chest, then we can open up the arteries, the narrowed or blocked arteries with coronary stenting or angioplasty. So we can put a catheter up through the artery in the wrist or in the leg, and then we can go inside the artery and then put a stent or pipe inside to open up the artery so that blood can flow through it and to the heart again. Now, if the disease is very, very bad, let's say you have disease in all the three arteries supplying the heart, and if within one artery there are several narrowings, then if you can imagine, stenting would not be a good option, because then we have to put so many stents in so many arteries. So in that situation, an operation to bypass all the narrow arteries will be the best option, what we call coronary artery bypass surgery. So for this procedure, we will take a blood vessel from under the chest wall, and then some other blood vessels from either the leg or from the arm to bypass all the narrowings. So it's like building a new highway to bypass all the old roads. So all the old roads still stay there, so blood can still travel through all the narrow arteries, but they also have a new highway, new blood vessels, which will bypass all the old roads to bring blood to the heart. So if we compare the three treatments, medical treatment, coronary stenting, and bypass surgery, if you have got very, very bad disease, then bypass surgery will help you to live the longest. So you will live to the and you will live the longest and be have the best control of your symptoms in the long term if you have got very bad coronary disease. If you do not have too bad coronary disease, so let's say just one vessel is narrow, then coronary stenting is the best treatment if medication alone cannot control your symptoms. But if you can take medication and that controls your symptoms, then in most cases that is good enough. Of course, the bypass surgery is a more invasive procedure. In most cases, the risk of bypass surgery is about 1%. There's 1% risk of not surviving the operation or having a stroke, bleeding, infection, or other organ failure. And you have to stay in hospital usually about 1 week. The full recovery after bypass surgery is up to 3 months for you to feel better than you feel before the surgery. So there is a bit of a trade-off in that you have to stay in hospital for 1 week, and then there's a 3-month recovery. But in the long term, that is the best treatment if you have very bad coronary disease. Stenting, on the other hand, of course, the recovery is much faster. So if you go for coronary stenting, you'll just be in hospital for usually 1 night, and then the recovery is only a few days. But then the drawback is that the long-term results is not as good as bypass surgery, and we're looking at beyond 3 to 5 years time. And medication is, of course, the easiest. You don't have to go into hospital at all. You just take medication, and most of the time it's very good. But if the disease is very, very bad, then the control of symptoms and also your survival, how long you live, is shortest with medication alone. So very briefly, that is coronary disease. Of course, the heart is quite complex. So if we open up the heart, if we look inside the heart, so I've opened up the heart. Don't know if you can see, but inside the heart you can see is an empty space. There are 4 chambers, 2 chambers on the left side and 2 chambers on the right side. And separating each of these chambers is a heart valve. So there are 4 heart valves, 2 valves on the left side of the heart and 2 valves on the right side of the heart. So the valves on the left side of the heart is one is called the mitral valve. The mitral valve separates the heart from the lungs, and then another one, this valve here, that is called the aortic valve. So the aortic valve separates the heart from the rest of the body. So these valves over time can also get disease. So these valves can start leaking, or they can get very narrow. So the valves typically open and close. So when it opens, blood flows through it, and then when it closes, it prevents blood from flowing in the wrong direction. So the valves in the heart serve to make sure that blood flows in one direction through the heart. So when the valve is leaking, let's say the mitral valve, this valve here, if it's leaking, then blood will flow in one direction, and then when the heart relaxes, blood will go back towards the lungs. So typically these patients will get short of breath because then the lungs can become congested. And also the heart has to do more work because it's leaking. So over time the heart will get bigger, and if it's not treated, then it can get weaker. So if the leakage of the valve is just very mild, then most of the time this can be controlled with some medication to get rid of some fluid in the patient, or some medication to improve the heart function. But if the leaking valve is very bad, a severe leakage of the valve, then unfortunately medication alone is not going to be very successful, because this is essentially a mechanical problem. Then surgery will be needed to repair the valve. So most of the time, if the problem is with the mitral valve, which is this valve here, which separates the heart from the lungs, this valve can be repaired very easily with surgery. And that's the best treatment, because it is all your own tissue. We just repair back the leaking valve. But sometimes the leak is so bad that we cannot repair the valve. Then in that case, we have to replace the valve with a new type of valve. So if we have to replace the valve with an artificial valve, there are 2 types of valve we can use. One is made from animal, either from the cow or the pig. So it looks like this. This is an example of an artificial valve from an animal valve. We can remove the faulty valve and then stitch this new valve into position. And then another type of valve we can use is a metal valve. So something like this. So this is made of metal. So the metal valve will last a very long time. It will last usually the lifetime of the patient. But the drawback is with metal valve, we have to give the patient a very strong blood thinning medication called warfarin to prevent any clots from forming in the valve. So with that medication, we have to monitor the blood levels of the warfarin, because if we give too much of the medication, then that can cause bleeding. If we give too little of the medication, then that is not enough. That can form clots in the valve. So that is the drawback, but it lasts a lot longer. So we advise this metal valve or mechanical valve for the younger patients in whom we expect to live a very long time. For the older patients, we will advise this animal valve made from pig or cow tissue because you don't need the very strong blood thinner. But this valve will not last as long as the metal valve. It will last about 15 years. Then after 15 years, we may have to do another operation and put in a new valve. That's why we advise this valve for the older patients. So those 70 years and above, we will advise the tissue valve. Whereas the younger patients, those less than 60 years of age, we will advise the metal valve. But of course, the best treatment is to repair the valve. Then we don't have the problem of blood thinning medication, and repaired valve will also last the lifetime of the patient. So as far as possible, we will try to repair the damage or the leaking valve. But if it's not possible, then we have to replace it with a new valve. So that's the valve. There's the mitral valve, the aortic valve on the left side. Then on the right side, we have the tricuspid valve and also the aortic valve, the pulmonary valve on the right side. Now, although we can do surgery on the heart, on the heart valves and then on the coronary vessels, it is important also to appreciate that even after surgery, we still have to take the medications because the medications can help to improve the function of the heart. The medications can help to thin the blood. It can also control various other factors like the blood pressure, all of which influence the long-term results of the heart function. Another thing with the heart which can go wrong, so this is the heart, and this big red thing here is what we call the aorta. This is the main blood vessel which brings blood out of the heart to the rest of the body. So the aorta in some patients can get bigger, can dilate, can balloon out, can form what is called an aneurysm, an aortic aneurysm, which is an enlargement or dilatation of the aorta. So one of the risk factors of this is high blood pressure. If the blood pressure is high for a very long time, is uncontrolled, then over time this can cause the aorta to gradually enlarge and cause an aneurysm. If you have an aneurysm, it is very important to control the blood pressure to prevent the aneurysm from getting any bigger. If the aneurysm has reached a certain size, then we will advise changing the enlarged aorta, because a risk factor for aortic aneurysms is that the aorta may tear or it may rupture, it may burst. So of course, if the aorta tears or ruptures, then that is very dangerous and patients may not survive. If the aorta starts to tear, then the patient will feel very, very severe pain. It will be the worst pain the patient has ever felt, and that can be pain in the chest, or it can also be back pain. So if we do have what we call an aortic dissection, which is a tear in the aorta, then that needs to be treated urgently. First of all, we need to lower the blood pressure very quickly, and then if the aorta is already torn, then we would need to replace the torn aorta with a new blood vessel. So we have this sort of grafts here, which is an artificial aorta. We can then replace the torn part of the aorta with a new graft. So this graft is made of very strong material. It is waterproof, and we just suture it to the new the aorta to replace its function. And depending on how much of the aorta is torn or how much of the aorta is dilated or aneurysmal, we may just need to replace the front part of the aorta. So we would then just use this graft. If we need to replace the more distal part of the aorta, which includes the blood vessels supplying the head and neck, then we want to use this part of the graph, which has got these branches which go to the head and neck. And then this graph also has a stent we can put into the descending aorta, so the lower part of the aorta. So of course it is much better to prevent the need for this surgery, and one of the key things is to control your blood pressure. And then if the aorta is already big, it is best to do this surgery electively, so in a planned situation. Then the risk of the surgery is very, very low, rather than wait until the aorta is already torn before we do the surgery. And then of course after the surgery, it is still important to control all the risk factors for the high blood pressure with medication, with lifestyle changes, reducing the salt intake in your diet, for example. So another thing with the heart, in order for the heart to work, the heart, I mentioned, is a pump. So the heart also has its own electrical supply, its own electrics. So the electrics will tell the heart when to work, when to pump. So the heart has got two parts, an upper part and a lower part. So usually the upper part will pump first and then the lower part. So it has to work, it has to coordinate itself. And this is dependent on the heart receiving this electrical signals. So sometimes this electrical signals can go wrong. So sometimes the heart can beat very irregularly because of the problem with the electrical supply to the heart, what we call atrial fibrillation, for example. And there are various other conditions which affect the electrical conduction of the heart. So in this situation, again, there are medications we can give to get the heart electrics to function normally again. But if with medication we are unable to control it, then we can do something to burn the faulty electric supply of the heart, what we call ablation. So we can correct the abnormal electrical supply to the heart, so that then the heart will beat normally again. One of the risk factors with irregular heartbeats or atrial fibrillation, because the heart is not contracting properly, is that tiny clots may form in the heart. So if you have this condition called atrial fibrillation, then we will advise going on some stronger blood thinning medications to prevent blood clots from forming inside the heart. Because if blood clots inside the heart, then that can be a risk factor for strokes in the longer term. So this is a summary of the common conditions which can affect the heart, and very broadly I've just summarized how we can treat these various conditions of the heart with medication and with procedures and with surgery. So if you have any questions, I'll be very pleased to answer. Thank you again for inviting me today.
Thank you, Doctor, for all this information. Now that we learn about the various conditions of heart disease, I think first of all, we'd like to know what is the cause or the factors which causes heart failure. Is it mainly due to genetic or lifestyle?
Yeah, good question. When we talk about heart failure essentially means a weak heart. So a weak heart which is unable to pump enough blood to supply the rest of the body. So the body has got the different organs like the brain, the kidneys, the liver, the stomach, the arm and legs. So all of these organs need to receive blood, and it's dependent on the heart to be able to pump enough blood to meet the needs of all the organs. So when the heart gets weak, it's unable to pump enough blood, and so this can affect the other organs. The patient may feel short of breath because the lungs are unable to, it's not getting enough blood, or it's getting congested because the heart is not pumping the blood away from the lungs. They may get a bit tired or lethargic because the brain is not getting enough blood. The kidney function may also be affected because the kidney is not receiving enough blood. So any condition which can cause the heart to become weak and big can cause heart failure. So there's no one single cause of heart failure. There are various different conditions which can cause heart failure. So I talk about coronary artery disease, for example, blockages in the blood vessels supplying the heart. So if there's extensive coronary artery disease, if there's very bad coronary artery disease, and if this is not treated, that can cause the heart to become very weak. So that is one of the causes of heart failure. And to treat the heart failure due to coronary disease, first of all, we have to treat the coronary artery disease. So we have to treat the cause of the heart failure. And in addition to treating the cause of the heart failure, there are also medications which can improve the heart failure, independent from the cause of the heart failure. So we have to treat the coronary disease with medication, and if necessary by stenting or by bypass surgery. And then in addition, there is medication to treat the heart failure itself. And then we talk about the leaking valve. So the leaking valves also can cause heart failure. So if we just leave the leaking valve and the valves are leaking for very badly for a very long time, then the heart will, because it has to do so much work, over time it gets bigger because it's trying to pump more blood out to compensate for the leak. So over time the heart will get very big and you'll get very weak. So that is another cause of the heart failure. So for that cause of heart failure, we have to correct the leaking valve or the very narrow valve by surgery, and also we have to give the patients the medication to reverse the heart failure. Then another cause of heart failure is genetic. So we can have dilated cardiomyopathy, what we call idiopathic dilated cardiomyopathy. So this is a condition where the heart just gets very weak. We do not know. We know why that happens, but we do not. And we know the molecular causes of the heart failure, but we do not know why in some patients they have this sort of heart failure, whereas in other patients they don't. So if that patient has this particular type of heart failure, then they can be treated with medication for the heart failure. Then there are other factors which can cause heart failure, like alcohol. So if you drink too much alcohol, then that can cause heart failure as well, what we call alcoholic cardiomyopathy. And then viruses can also cause heart failure, viral myocarditis. You can have viral infection that can cause heart failure. And there are a few other rarer causes of heart failure. So the causes of heart failure is multifactorial. It can be genetic. There are some genetic conditions which can cause heart failure, and it can be acquired. There can be medical conditions which can cause heart failure as well. So heart failure is a very broad term, and there are several causes of heart failure. And to treat heart failure, we have got medications specifically to treat heart failure, but it is also important to find out the cause of the heart failure so we can treat the underlying cause of the heart failure.
How about the symptoms, doctor? As I know, the symptoms may be very common, which is also similar to other medical conditions. Hence, how do we identify the symptoms of heart disease, and when should we get alarmed and also seek medical advices?
Yeah, good question. The symptoms is, when there are symptoms, I think it's important we always look for the cause of the symptoms. And it can be difficult because the symptoms of heart failure or heart disease can also be a symptom of other conditions. So for example, in heart failure, the patient typically gets short of breath, they can get out of energy, they can get lethargic. But these are also the symptoms of other conditions, like if you've got asthma or you've got other lung problems, or if your blood count is a bit low, you can also present with the same symptoms. And then similarly, if you've got coronary disease, chest discomfort, chest pain, this can also be similar symptoms to gastric conditions. So if you've got reflux or acid symptoms, it can also present in a similar way. But there are typical patterns which make you suspect that that your symptoms are due to the heart condition. For example, if the symptoms get worse when you exert yourself, when let's say you only get short of breath when you start walking, or you get chest discomfort when you start walking or doing some exercise, then that does suggest that it may be related to your heart. But having said that, if you have left your symptoms for a very long time and not treat it early, at the later stage of heart failure or coronary disease, you can also get these symptoms when you're not doing anything. So you can get short of breath when you're just resting, sitting down, doing nothing. You can get chest pain, you can get short of breath because the heart has got so weak. And another sign that it may be related to the heart, if your heart is very weak, is that when you sleep, when a lot of patients with advanced heart failure, they cannot lie flat. They have to sleep with 2 or 3 pillows, because when they lie flat, they get short of breath. So that is again one of the symptoms that the breathing difficulty is due to a problem with the heart. But it's important also to recognize that in many patients, by the time they get these symptoms, actually the heart failure is very advanced already. Because what happens is, when the heart first starts getting a bit weak, or let's say the heart valve starts leaking a little bit, the heart will compensate for this weakness by getting bigger, so that with each pump, it pumps more blood out of the heart. So because the heart is able to maintain how much blood is pumping out of the heart to the rest of the body, the patient does not feel anything. They feel well. But actually, over time, the heart is already getting bigger already. And very often, by the time the patient feels something is wrong, the heart is already very big and very weak already. So it's already at quite an advanced stage. Which is why it's important that the patients should go on for a medical checkup, probably at least once a year, so that if there's something wrong, it's picked up early and it can be treated with medication at an early stage. And similarly with coronary disease, the lucky patients are those who have symptoms. Unfortunately, some patients have no symptoms. Suddenly they have a heart attack and then they don't make it. So those are the most dangerous sort of conditions, because particularly in diabetic patients, very often diabetic patients with coronary disease, they don't have symptoms, and then suddenly they have a heart attack. So those conditions which are a little bit, we have to be a bit careful of. And the best thing is actually to identify the risk factors for all these conditions. So with a medical checkup, we will know whether you have high cholesterol or high blood sugar or high blood pressure, or a family history of heart conditions. So if you have any risk factor, then at least we can treat this early, and we can advise lifestyle changes to prevent the disease from progressing to a more severe stage.
Yeah. Well, I guess that's the reason why they call heart attack is actually the silent killer. So sometimes it doesn't show any symptoms at all. Am I right?
Yes.
Yeah. Doctor, there's another question which I'd like to know, right? You mentioned about all sorts of treatments, all right? Bypass, stenting, and medications. So for patients who are already diagnosed with heart disease. So I'd like to know, right, what is your advice to these patients, or how do they have to maintain a good health? Is there any particular food they must take, or is there any supplements which could help on their heart disease while they have also taken the treatments as well?
That is very important, because what we eat very often determines our how healthy we are. So first of all, there are food we should eat less of. So, for example, we should eat less oily food. We can still eat, but if we reduce, I think we can eat everything in moderation. Don't eat too much of the unhealthy things. So the food which is deep fried, eat less of it. The fatty food, red meat, for example, pork, beef, eat less of it. Eat more fruits and vegetables, more fish, more chicken. These are the healthy diet. And then there are food which can lower the cholesterol if you have high cholesterol, like oats, and then avoid too much alcohol, for example, because that can also cause heart disease. So apart from medication, definitely the diet has got a very important contribution. Then, of course, also we should eat less carbohydrates and more fiber, increase the fiber in our diet, that to improve the heart conditions.
I see. Well, of course, the prevention is much more better than cure. So in terms of that, I believe that we should practice a healthy lifestyle, do some exercises, and of course, eating healthy is one of the great help to actually help us to prevent a heart disease. Am I right?
Yes, exactly. Yes, taking regular exercise is also extremely important. Yeah. So in fact, so there's exercise and lifestyle, control of lifestyle, and of course smoking. Don't smoke. Smoking is a very bad factor which causes heart disease, and smoking causes a lot of other medical conditions, as like lung cancer, for example. So definitely avoid smoking. And then take enough sleep. That's very important at night. At least 6 to 7 hours of sleep, because if you have a very stressful lifestyle or lack of sleep, that can also be a cause of heart disease.
I see. Okay. Well, Dr. Chan, thank you so much for your time. Right, taking the time out from your busy schedule to share with us all this important information. So I hope everybody benefited from the talk, and also brothers and sisters, a healthy heart is vital to overall our good health. So we should start embrace a healthy lifestyle, eat healthy, do your exercise, and also take care of your heart. So once again, thank you so much for joining us today. Until we meet again, let's keep smiling, stay safe. Goodbye.
Thank you. Goodbye.
Thank you.
世界不停转动，永远有光明开始。面对挑战，感受信仰的力量，散发光和热情，生命有无限光彩。珍惜眼前和谐，一步步靠近。